I was on the other side of the fence for most of my life and really against the grain of society, I suppose.
What am I even doing here? They're not going to help me.
What can you say? You know, no one wants to believe you, so you stop talking.
They whisper and they giggle behind, you can hear it, and it's really hurtful.
It made me feel hopeless, made me feel dirty, made me feel ashamed.
Going to emergency rooms and getting treated like I wasn't a human being, but treated as an addict. All they thought I was there for was drug seeking when I actually needed their help. Treat drug addicts and alcoholics and people that are suffering from addiction with the respect you would treat anybody else. They're human beings and they're hurting and they need your help. The reason why they're using drugs or alcohol, they're going through something and they need help.
When I was engaged in my addiction, I had an abscess on my arm and I went to the old 8th Street clinic, the walk-in clinic there. Had to go in every 8 hours for IV infusions and for antibiotics. And while I was there, my wife would come and sit with me. And I was in a lot of pain and discomfort. This one security guard was coming in and checking on me every couple of minutes and just seemed to be looking for opportunities to kick me out of there, to deny me service. It just sets up this attitude, you know, or reinforces a negative attitude towards authority figures, and to treat people, anybody, everybody, with compassion and understanding.
When I was 17 years old, I ended up in Vancouver, and I was down in the Main and Hastings area at the time, and was trying to basically live on my own, and ended up working in a hotel that was not such a good hotel, but I got a job at the front desk to make ends meet, and unfortunately there was someone in the hotel that had overdosed on a speedball, and so I had called 911 and I went up there to help her, and she was having an epileptic seizure and choking on her own tongue, so I turned her on her side and I ended up getting pricked with her needle and dropped her, and she died instantly, and 3 months later I was diagnosed positive with HIV and Hep C. Every time I went to the hospital, they were just like ignorant. Because I was HIV and Hep C and the fact that I had pneumonia, they always kept me isolated. I wasn't allowed to have visitors, and when I did have visitors, they always had to wear like gown and a mask. And I was kind of angry and frustrated, and so I guess I got to the point where I just signed myself out of the hospital. I think for them to improve their services, they would have to show a lot more compassion and understanding towards people that have a terminal illness or you know, are in the hospital sick, and not make them feel like they're animals and they have diseases. Like, I guess they, you know, just to treat them like any other patient.
For someone to tell me that it's not real, that it's delusional and grandiose. Sure, the schizophrenia plays a part in the stressors, but if you don't understand it and you don't know what I'm talking about, it might actually really be real. That's a bad experience, is when people do not believe what I think about or what I have to say. That's scary. And when those person talks about those stressors, take it as that's what's making them stressed out and symptomatic. Don't tell them what their life is versus what you read in a textbook or what you watch on TV.
You need to learn from the client. They are the expert in their own life, and they're able to help you to understand where they are and to help them to solve the problems that they're currently experiencing.
There's a lot of clients out there who've struggled and keep struggling through the system, and any way to try and make that system better for them and stop the barriers that they're facing is is a reason why I do the job that I do. Make sure that they feel safe and comfortable in the space that they're in, and that they know that I'm not expecting anything from them, that I will be there for whatever it is that they need me for. The way I work is that I sit down with clients and I give them the time that they need and the time that they deserve. You know, they can just come in and check in and know that they can just say hi, and not because something has gone wrong, but because they want to tell you that something has gone right or that they've just had a good day.
It's very important that when our folks come into the healthcare system, come into any type of service, that they aren't met with resistance, that we don't slam the door for them, that we don't tell them that this isn't what they should do. We don't make them feel embarrassed. We don't make them feel ashamed of some of the decisions that they've made or where they are in life. They do that just enough to themselves.
I'd have to say a positive experience with SafeWorks. Just that they were really understanding and they were honest with me when I needed honesty. The fact that I could go there at any time during the day and just close the door and cry, and they would listen and we'd laugh, and with their pushes from other people, I got on the right track to recovery.
There's a program at Alpha House, the Sweat Lodge, and for myself, that experience, I mean, it really opened the doors to understanding myself and giving me a sense of identity and purpose, a place in the community, people to support me. During that time, I made that decision and realized what a waste of life it was in a cage.
I spent 9 months in jail, and I was looking at doing penitentiary time, but instead I wanted to turn my life around, and I wanted to do something in my life to change the cycle that I was going through and the cycle for my children. So instead of going to the penitentiary, I chose to take the Calgary Drug Court program. What they did is they gave me a chance to tell my story, and they gave me a chance to give back to the community and to go places and talk to children and teenagers, and let them know that it's not all that it's made up to be out there on the street, and I think it really helped other people.
Success to me looks like somebody taking movement towards their big goal just a little bit every time. I never like to see any step as a wasted step, especially since so many barriers have been put up for these folks, and they've been told no 1,000 times before.
If they can come back to me in a year and tell me that they've been clean, or that they have housing, or that they're on their medication, that's a success for me. So it can be a small thing or it can be a large thing, and it really is dependent on the individual.
I think it's important to establish a relationship of trust quickly with your clients, and that starts with just a smile and a little bit of small talk, greeting them just like they're an old friend.
Someday somebody might notice and see what I've been doing all along, or what I'm trying to do, and give me a hand. And, believe and say, you know what, yeah, it was a pretty rough road, but you made it to the end. Here we are today.
A lot of my friends say if Horace can do it, I can do it, because I was like the poster child for the criminal out there, so I did it, we can all do it.
It's a relief because somebody is in your court doing the best they can for you, and they're putting in their best effort.
They cared about how I felt and what I needed, and it was compassion that I hadn't received from other agencies.
Because of what a person does or how they look, that they need to be treated a certain way. It's more than that. We need to look into individuals as a resource, as people of value that are worthy of time and effort.
Be open-minded. Don't be afraid to admit that you might not know everything. And be mindful of who you're talking to, because you are dealing with their life. That is their life you're dealing with.
Some things happen in life that you can't control, but we're all human and we all make mistakes, and we all deserve another chance, and for someone to believe in us.